Okay, right. Well, we'll get started. So my name is Petronella Petersen. I'm a research fellow at the Royal College of Surgeons. I was the chair of the Development Studies Association of Ireland until last year, and handed over to Dr. Susan Murphy, who unfortunately is traveling at the moment, so she can't be here with us. And we seem to have picked a crazy busy week because other steering committee members of DSAI are also teaching, traveling, and hosting other webinars. So yeah, as a result, I've I've agreed to give this little welcome. This was also a little bit an idea that Miriam, who is the administrator and coordinator of DSAI, and I had way back when I was still involved with DSAI. I was working as a postdoc on a Coalesce funded project, and realized that we really should kind of gather up other researchers who also benefited from the Coalesce funding to share our results in a coordinated fashion. So maybe per country or per subject or per sector. And this is the first one that has finally come together. And I think that DSAI is hoping to have more of these as time goes on. I just wanted to welcome you all to this DSAI event, and I also want to draw your attention to DSAI. Please go onto their website. You can join up for free, and DSAI has its annual conference coming up early January next year. And there is a call for abstracts out right now on their website, which is still live for another few days, maybe even a week. So it's a great platform to share your research, to meet other people who are also in the area of research and project administration, application administration, implementation. In Ireland, and it's a great way of meeting people because so many of us are spread right across all of the different universities in Ireland and the NGO sector, of course, as well. So yeah, I think it's really worth having a look and joining if you can. So yeah, thanks all for coming. We have four great research projects being highlighted this hour, and we'll start straight away. Professor Anne Matthews is here. She is going to kick off the very first project findings session. I worked with Anne as a postdoc on the project that she led. So Anne will present most of our slides, and I will come in just with some of the findings of part of the project that we conducted together, with also some of our Malawi colleagues as well. And well, thanks very much. Once again, I look forward to hearing everybody else's presentations as well. Thanks.
Hi, everybody. Can you see that okay?
Yes.
Great. Yeah. Thank you so much, Ellen, for the warm welcome for everybody and for us. And this is just a fantastic idea. And as Ellen said, the timing is difficult, but it's never perfect. So this is myself and Ellen. I should say Ellen and mine. Ellen was the postdoctoral researcher on the project, and honestly, nothing would have progressed beyond our initial kind of thoughts without Ellen on board. Professor Ellen Chirwa was the co-PI under the Coalesce arrangement from the University of Malawi. University of Malawi, but Kamuzu University of Health Sciences, after the Kamuzu College of Nursing changed structures, and Dr. Aisling Walsh of RCSI was a co-applicant. Maybe just to say from the outset that what attracted me to the Coalesce funding was that, unlike other proposals, the level of detail in one way that went into the proposal just left wasn't so great in that it left some scope for, really working with the partners in Malawi once the project had been funded and started to identify what we actually wanted to do. So rather than kind of committing ourselves to too much or things that we wouldn't have really been able to see or understand collectively, it meant that we just had this kind of scope. So at that stage, it was just a 10-page proposal that included CVs and backgrounds and all sorts. So it meant that we could keep it at this maybe slightly higher level of enhancing evidence-based infant feeding policy implementation in Malawi. And it did start in 2019. We had some extensions, like a lot of people around the time, because of course COVID hit in 2020. So this is, I suppose, in the end, and you know, there became a greater emphasis on desk-based studies, just with COVID impacting on everyone. And just to mention colleagues who got involved from the University of Health Sciences, and especially later on then in data collection. So just on our uh, desk review of the what would be traditionally known as Baby Friendly Hospital Initiative, but had been extended out to community. And then looking at this whole area of care groups, which emerged from our first visit to Malawi, and really looking at, well, what do we know about or what do we think about how they work? And then doing some element of research on care groups. And like I say, Ellen led all of that. Aisling led this scoping review. And, scoping reviews, sometimes I do systematic reviews, Cochrane collaboration reviews, Cochrane reviews, and this scoping review I think possibly took us 2.5 years, which sounds impossible, but that is what happened. And we had about 7 of us working on it, but we were very proud to get to the end of it. So that's just what I'm going to cover, maybe some of those outputs with Ellen. So the scoping review, which is here, that was published eventually there 2023, the realist review, and then the evaluation of care groups as they operated. Just to say, we had a lovely website. It's still there as a resource for the various parts of the project we're doing, thanks to Ellen. So the Baby Friendly Hospital Initiative, again, just on that initial visit where we met lots of stakeholders, including we were very grateful to the Embassy of Ireland in Lilongwe, and especially the focus on nutrition there. And that really helped us, as well as UNICEF and lots of other partners and NGOs in Lilongwe in particular. So I suppose we knew the Baby Friendly Hospital Initiative was important globally, but there had been a renewal of it in Malawi. So this was being spoken about a lot. So I suppose we wanted to try to see, well, here we are, what do we know about the Baby Friendly Hospital Initiative and also the Community Initiative? And we had 278 articles included in our review, probably reflecting the fact that it's a very broad topic, which probably, in hindsight, we created that for ourselves. I suppose the patterns that we found out of that scoping review, sensibly enough, national policy and health systems really impacted that implementation, and then more specifically facility level policy. Certain steps about, they're the 10 steps I meant to mention there about maybe not giving fluids alongside breastfeeding and all of the other steps that help to protect and promote breastfeeding. The community initiative is only implemented in very few countries, and there's a lot of resources needed there. Health worker breastfeeding knowledge was quite mixed in the studies reviewed. And then for women themselves, then knowing more and understanding more was helpful, and we were able to identify those gaps. Ellen, are you happy to take up the realist synthesis, or I can keep going at that
No,
stage?
I'm happy to carry on from here. Yeah, so this is
Brilliant.
the research that I did again with Anne and the rest of the team. But it was really really great to actually learn about the realist synthesis and realist evaluation. This is one thing that I got to really learn while at kind of at the start of this project. If you can carry on with the slides, then and then I can. You can put them back in, yeah, presentation mode. So we started with a realist synthesis of evidence. So that's kind of like a desk review. One of the things that's really great about the realist method that they're very keen to have to include things like case studies and articles, how to document all sorts of different guidance and very kind of basic program evaluations. This, kind of bringing them all together allowed us to extract evidence on the context in which interventions were taking place, the mechanisms in which these interventions seem to work and be successful or otherwise, and the outcomes. So how do certain context and mechanisms connect to outcomes and that kind of allows us to have a much more granular understanding of how particular implementations work, even kind of based on very simple details that we extracted from case studies and program evaluations, and then the joint sort of power and the sort of the understanding comes from bringing it all together. So our two main findings, sorry, just go back one more. Sorry, the two main findings from the desk review were that, but we're on a motivational kind of strategies and how motivation and comes about among these volunteers of care groups. Care groups, I must say, are a type of community health worker group, which has been kind of like managed by each group is managed by a single individual who herself receives, it's sort of mothers groups. She herself, the lead mother, receives kind of training from a coordinated group, and there's a monthly training involved in the lead volunteer, and then that person again sort of is expected to meet with her 10 individual kind of mothers that she passes details on to. Most of the focus is on breastfeeding, on infant feeding, and on other kind of very basic community level health promotion. So yes, kind of the care group Arela Synthesis gave us great insights into how motivation works among these groups to do with having manageable workload and also meeting constantly or meeting on a regular basis to really kind of reinforce this camaraderie among the group members. And that was really interesting. That really came through when these groups are successful, you have those elements in place. We also found that kind of creating a conducive environment is really important for care group success. And here we found that care groups sort of emphasis on the implementing NGO or kind of like the leaders who do the teaching of the lead mothers, that they also engage in with the community, with the fathers and with the wider group, so that any kind of behavioral change that's being promoted can be taken up. And sort of barriers to this uptake can be removed by having the whole community on board with the lessons that are being shared. Okay, so there were the two findings, and we did write a paper on both of those findings. And then we also did primary research, or our colleagues in Malawi conducted primary research, very much kind of looking at care group efficacy and looking more generally what sort of role the care groups played in supporting mothers of children under 2 with breastfeeding, exclusive breastfeeding, infant feeding. And specifically, it was a real interest of our colleagues in Malawi. How about babies who are born preterm and with low birth weight? So what we found is that of the women we interviewed, we specifically looked to interview women who were mothers of premature and low birth weight babies, and we found that most of the women received their support for breastfeeding and infant feeding very much at the facility where the baby was born, and very little thereafter, very little after discharge from this community-based facility. We found that care groups weren't always able to reach the mothers after they were discharged, and neither were the official kind of structures that were supposed to be in place to kind of support women with young children and especially those with vulnerable babies. So was actually, we found that kind of both the official kind of public health staff or care groups weren't really able to reach those individuals very much. And the final slide. Um, so this sort of came to our conclusion that we looked in at the policy because in part we were trying to look at this as a policy comment as well. We realized that Malawi has implemented or basically adopted the care group idea, the care group structure, international policy, which in itself is really, really good that they actually kind of went and created a policy for these community-based groups so that it is becoming national policy. But what was a real shame is that there wasn't really any funding to support the implementation of that policy. Also, the policy was overly complicated, as you can see in the structure, the visuals on the screen. And this was later adjusted, but at this point, not that much attention was paid to how a more kind of updated version was going to be implemented. Overall, we found that care groups, much like other community health worker models, can be really effective in improving community level health and nutrition. But the structures need to involve a manageable workload. Somehow the harmonized Malawi model also had inserted additional requirements of the volunteers, which just meant that they were very, very hard to actually follow and implement. They expected too much of the volunteers. And volunteers also need to be sufficiently motivated. And again, then we kind of went back to that evidence that we'd already collected from the literature. If you have this, the right camaraderie among volunteers and also community recognition, those two things, they don't have to be monetary kind of incentivization and motivation. It can be as simple as kind of bringing women together on a monthly basis that kind of supports the camaraderie and kind of also supports greater kind of implementation and sustainability in the long run. So this was kind of were our main findings. A little bit of a missed opportunity in a way. Malawi going as far as implementing or adopting this policy. But because there was very little connection between the care groups and also and the kind of the public health staff who were meant to be providing care in the community, but were often very overworked. And couldn't always get to the community. The care groups could have been a perfect extension for them doing some of the community work on their behalf. But because there was little collaboration between them, little integration between them, that also kind of failed to take off in most places, which was a shame. But there's still scope for this policy to be implemented. And for the future care groups to integrate better as well. So that's it. Thank you so much.
Thanks, Ellen.
I'll hand over to the next presenter.
Hi, everyone. Let me just share the presentation. I'll be with you. It's all okay in terms of visuals? Okay, perfect. My name is Jakub Gajewski. I am also from RCSI. I'm a lecturer and research program director at the Institute of Global Surgery. And I'll be talking about the Akazi project that we have implemented in Malawi. We call it a story of hope. It's a project about breast health and breast cancer. And I'll tell you in a minute why do we call it a story of hope. This research project is on the other side of the spectrum. It was a kind of implementation research project with a lot of activities on the ground related to breast cancer, but also policy work and a few other things. But we kind of had a strong partnership with a company in Malawi, Agency for Research and Scientific Training, ASRT in Lilongwe, and Queen Elizabeth Hospital, clinicians from Queen Elizabeth Hospital. That helped a lot to get things off the ground during COVID. Just straight to the project. We have a few other projects in Malawi, so we kind of get ideas for different interventions across the projects. And one of the things that we identified in our surgical intervention that we've been running for over a decade now in Malawi is that there was a huge problem with breast cancer. And we looked at it more closely and we identified that this is the third most common killer in Malawi, with extremely low survival rates from the time of diagnosis. So people don't make it beyond 6 months. Most of them will die soon enough after they diagnose you. As you can see I'm sorry for the visual of the picture, but it's just.
Sorry for interrupting. We cannot see your slides.
You cannot see my slides?
Nope.
Okay, let me see what's going on. This one. Share. Now?
Yes, now, yes.
I'm trying to switch to presenters mode. Is that okay now?
No, now they're gone.
Let me see if I can do this now. Is that okay?
Yes, now they're fine.
All right, perfect. Thanks for interrupting. Yeah. So this is just oh no, sorry, this is just the slide that I was talking about. You can see the picture, and that's just because the patients are being seen very late. There is very little awareness, there is very little understanding of what breast health should look like, and that leads to catastrophic outcomes for patients. A lot of traditional beliefs, a lot of cultural influences that make breast cancer extremely difficult to manage in the context of Malawi. And the incidence of breast cancer are expected to exceed cervical cancer, which is currently the #1 cancer in Malawi. So we knew that from looking at patients in surgical clinics. So we wanted to develop intervention to address the project. Okay. And then we came up with the Akazi project, which was, Akazi means a woman in Chichewa, which is a local language in Malawi. And originally we had breast and cervical cancer, but because of COVID, we needed to limit the activities to breast cancer because we couldn't work closely with patients, and we couldn't implement the cervical cancer parts. We remained with the title, so the title is still about a woman. And a lot of times when I talk about the project, people initially react saying, okay, so this is about screening. You need to have a strong screening system in place. Actually, the WHO recommendations are not about screening. Screening is not recommended for low resource settings because there is no capacity to absorb the demand that screening creates. The strategy that is appropriate is called downstaging, which is to concentrate on patients who already have developed some systems and identify those ones at risk of breast cancer and treat them as soon as possible. So that's what we've been doing throughout the years of implementing the Akazi project. So it's not a screening project, it's a downstaging project. No, the focus is on downstaging of breast cancer. The specific objectives, we had 3. We wanted to, first of all, comprehensively assess the current health sector capacity for early diagnosis of breast cancer. So we did a national level mapping of what's out there, who's there, and what kind of services are being provided or not, and what kind of policies they're training, and all the different things that are important for an effective cancer control program. We also wanted to look at strengthening early detection. So we were looking at kind of how do we build capacity of the frontline workers to help them to identify patients, the downstaging approach. And the third element of the project, the third level. So you can think about it like a triangle: the policy level, training, education, and the community work, which was to improve breast health awareness. Like I said, a lot of cultural beliefs, a lot of cultural influences. The type of society that Malawi has is kind of a strongly man-led. So, that has an effect on anything to do with intimate body parts health. So this is the kind of a long story short, a snapshot of some elements of the national level assessment, of the capacity assessment. The paper is under review now, but we looked at several aspects. If you look at the themes, they're not all, but I wanted to highlight a few. So leadership, financing, HR, service delivery, and access to different types of medicines and technologies. We looked at strengths and weaknesses. So I want to highlight 3 weaknesses. because that's what I'll tell you more about. So implementation of cancer policy is poor. There was no breast cancer specific policy in the country. So that was one of the gaps that we had identified. There was no training available. So if you were training as a physician in Malawi, there was no dedicated course on breast cancer or breast health in general as part of the curriculum, which we considered a major gap. And then the last thing, there were only 2 breast cancer clinics for a country of 21 million people at the time. So one was open for 2 hours on Tuesdays, one was open for 3 hours on Wednesdays, and that was all the patients had in terms of capacity to be seen by someone who knew anything about breast cancer. So quite a lot of gaps, quite a lot of challenges, but based on that, we developed an action plan so the training objectives, we developed a training, a 3 days course. As we speak, there is another iteration of that course being delivered in Blantyre in Malawi. I got pictures that people were doing the pre-test in the morning. So this course is being scaled up nationally. You can see pictures from the first iteration. Trainer is looking at the actually RCSI donated silicone breast model. They also looked, the training was also delivered on real life patients because that helps people to practice, the real life skills. And then this is the first cohort that was trained in 2023 in February. They have the certificates stamped by the Ministry of Health. And this is what we are very proud of, which is the training manual and breast clinical examination, a guide for clinicians that is an official Ministry of Health document that came out of the project. It has Irish Aid referenced in it. It has Coalesce referenced in it. It has the team referenced in it. And so we're very happy that we've contributed quite a lot to develop this. But it is a national policy that is an output of the project. In terms of awareness, we worked with the communities, and like I said, there is a lot of cultural influence in Malawi that kind of determines what the fate of women who develop, or men to a lesser degree, because breast cancer in males is not that common, but females in particular. You can see on this picture that the woman who is a bit blurred is our consultant who developed we also, I don't have enough time, but we developed a very comprehensive communication strategy, which is an awareness raising campaign, really, that we developed through media, through radios, through all the different possible channels, but also in person in communities. So we had a local person who specializes in dealing with these kind of things, and she was the one in charge of meeting the local communities and giving them the message basically about the importance of breast health. Very common reaction from the people who are trained was, oh, we've seen women like this, but we always thought that there was some sort of a witchcraft. That was they did was some sort of wrongdoing, and they were punished. So they didn't understand that this was not a force majeure. There was not some sort of an act of punishment. There was just a medical condition that was supposed to be diagnosed and treated. That was the kind of the idea was that they would go back to their communities, and then whenever they would have that patient or that woman in the community would say, okay, we know what this is, and this is not that you're a wrong person or whatever. Here are the contacts for the clinician. So that would the awareness would help to unblock certain unblock blockages, but make them step up and seek care when the care is needed. So that's on the advocacy piece, which I also wanted to highlight. There was a nice story that we developed. We wrote an article on RCSI website about 10 million women, 5 hours of time breast cancer in Malawi, as you can see at the bottom. And it was up to date. I think it's the highest retweeted and liked and viewed tweet from RCSI. It went viral in Malawi. It created a lot of kind of a national debate on the status of breast cancer. So a simple thing that we could have never anticipated that went, it went crazy locally, but it's also important that we invest heavily in communications because you cannot really, the research on its own is kind of this whole body of literature how ineffective it is if it's not well communicated. So we do a lot of work in terms of as we go communication and that paid off. This is a very good example of how important it is to do those kind of activities alongside the research ones. So just to wrap up, what we I can say about the ACASI project, it has improved awareness of cancer in rural communities through the awareness campaign, improved utilization of healthcare services because women, once they go for other services like family planning or whatever other, things they want to do on those clinics, they will be offered a clinical breast examination as part of a routine care. Improve functionality and effectiveness of the health system because the ones with potential problems will be referred to the place where to the tertiary hospital, to the clinic where they can be seen. And we also hope that in the long term this is going to reduce the mortality and improve life expectancy for women with breast health issues. And I don't know if I can play a little video that I have here on this. Can you hear the sound? So this is how we delivered the message to the women through singing. So she's singing a song about breast cancer. So this is our communication strategy when there is a song about breast cancer and the crowd sings together with the consultant, and then they will remember a bit more than just electric. Yeah, so it's from my end, and thank you very much. And I'll pass on the mic to the next person. Thank you.
I think Eunice is up next.
Yes.
Talking about the smokeless village. Thank you very much. Take it away, Eunice.
Okay. Thank you so much for having me here to present our project that was based in Usungwi village in Chiradzulu district in Malawi. The team was led by Professor Debbie Stanistreet, co-PI by Professor Joseph Msungo from the Kamuzu University of Sciences, and then RCSI as well, other researchers, and also Professor Sarah Jowett from the University of Nottingham. So what we looked at was the issue of air pollution in a rural community in Malawi, but we wanted to use the approach that's been dabbled on within the WASH sector. So we went in and applied a community-based participatory research approach. But what was, apologies there, I just need to minimize and maximize. Okay, now, but what was the main reason why this was very important? According to the World Health Organization, over 7 million people will die prematurely just from air pollution alone. And out of that, about 3.2 million just from the type of fuel that they use to cook within the home. And we know that within the African setting, cooking is more than just food. It is life, it is culture, it is social. So having that burden just from cooking alone is really, really very big. And then the fact that it affects more of women and children just by the mere virtue of their role as the cook or as the food provider within the home. So we looked at this within the Sustainable Development Goal 7.1 and also health. But went beyond that and we looked at the broader determinants of air pollution, the fact about the energy poverty that is affecting over 2.3 billion people globally. The inequality there is that 1 billion people out of that resides within the sub-Saharan African region, further highlighting the issue of the inequalities that comes with air pollution. And there's quite a lot of agenda out there, about what's going on. We know this is there, but the fact that interventions that has been rolled out, there is reports about low uptake, and just the fact that the moment the project is out, that's it. There is no sustainability there. And some of the factors are the fact that interventions that are being given are too expensive, they have poor quality, does not meet the design that the people within those community actually needs. And that allows us to look at what we were already thinking of, involving the community's voice in our design and in the implementation of what we're doing. So what we did do, we figured that if we've give the platform that we have to the community to lead the strategy, hopefully we can reduce the levels of the household and ambient air pollution, reduce the risk of burns within this community, and also support, enhance, or build capacity building of both ourselves and also the community members. One of the key findings that we found was the really important aspect of involving the interest keepers or the relevant partners within this. And we started this during the pandemic, and I think my fellow presenters have said that. So we needed to adapt our approach. We were meeting with the district environmental and the health officials online before we had access to be able to go into the Malawi community itself. We did the same thing with the community leaders. Thank goodness to our partners from Camus University, setting us up with themes while they were also in the community. But more importantly was when we now had access was to sit down with the leaders. And I think that's very important in the type of projects that we do to ensure that we are not going there to destabilize the existing, power dynamic within the community. And in addition to that, to be able to speak to the whole community themselves. Yes, we know the leaders have spoken to them, but to also start creating that dynamics that we're going to be working with. And I have to say that's one of the key findings was that was really very helpful, and we'll see that as we go along within the result. So we went about walking through the community in a transit work approach, which starts, further intensify our participatory approach and also that familiarity with the community, knocking at doors, saying hello, putting chalk and, and marking the doors. And seeing where locations are, structures are within the community, and also learning about the strengths of the community. And what we found is that this is an amazing and dynamic community, predominantly a farming community. And you can see where the issue of the air pollution would come in terms of them burning all the farm waste in preparation for the next planting season. When we went in the community at baseline, every single household was cooking on a 3-stone fire, and you can see the smoke there. The community is not connected to the electric grid, so that means there is no electricity, and majorly people will burn grass bundles or use battery cell powered torch to light their home. And like I said, they are just a dynamic community, have their own good structures in terms of governance. Women, children, all very involved in community activities. So I think that was really a good thing for us to establish at ground zero, because I was going in there thinking, it's going to be a power dynamic between men and women, typical of what we all read within our reports, but that wasn't the case, and I'm glad it wasn't the case. So one of the things that we also did was that we looked at the types of interventions that are already available in sub-Saharan African countries. And while we look at 23 cook stove brand, we used a scoping review approach. 20 of those cook stoves reduced air pollution, PM 2.5, but none were to this level that is safe enough according to the World Health Organization. And that just goes to show the type of interventions that are being promoted. As of the time of the review, 14 were available on the market. And in terms of cost, only 6 of them were costed below $40 and 2 at less than 10. And if you think about the gravity of energy poverty for a community that are living on less than $2 a day, affording any big interventions or costly interventions definitely is not going to be suitable. And like I mentioned earlier on, we also looked at what are the community themselves also talking about in terms of the interventions that's been proposed. So we have that published in our scoping review. Moving forward, throughout all these processes that I've already mentioned is this key aspect that keeps ringing out each time we engage with the community, that it is their story and we just have to let them say it. So how did we do that? We did use survey, which is traditional methods to collect this type of data. But in addition to that, we also measured, our kitchen level PM 2.5 for kitchens, for also that have kitchens, and even those that did not have a roof over their kitchen, they wanted us to measure it. So that's us there trying to tie the measuring part measurements to a roofless kitchen. But you know what? It's their story. We're letting them say it. But in the participatory approach, we engaged with community through participatory trusted walk, and basically just walking around the community, meeting people that are actively, working with anything that has to do with air pollution. It could be cooking, it could be making charcoal. We also used, photo voice, which was very, very powerful, with women, men, youth, leaders going around the community and using the photograph to really tell the story of the way they see their own way of life, of cooking, of engaging with energy. Those approaches really allowed that platform to be solidified with the community. We found that it allowed our community to be able to be partners within these projects. So thus moving our project really towards the way that we envision it to be. And one of the findings that comes with that participate transit work is finding women that, are cooking without a cover. And, like this woman says that she said, I don't have a cover for pots. You have to buy it. If I have, it will be hard to leave the food alone because you have to make sure it will not pour out or kill the fire. And I think that's very, very important because I've talked about energy poverty, but in there as well is that understanding of the way of life of the people, of the way the people cook themselves. So it's not just about they can't afford it. It's also that if they're stirring the enzima that requires constant stirring, they can't have a pot lid over it. So all these type of interactions and findings were shaping the way that we were thinking of how do we contextualize the intervention that we are going to be rolling out? How do we implement it such that we are not destabilizing the structure existing already within the community? So having said all that, at the end of the day, we co-created about 7 different interventions with the community and supported the community in deciding or ranking those interventions. So yes, we've talked about what the interventions could be. We had like 48 hours of sensitization to know how those interventions could be used. The powerful aspect of that is that power that the community had to be able to rank those interventions themselves, and also for us to explore how they came about having those decisions. So we come up with 6 sets of interventions. The carpenters, the artisans in the community made the windows, put the windows in. They were paid now, guys. Yeah, they were all paid, all their dues. We ordered the Chitezo Mbaula, gave a second set because the community said one was not enough. And you can see our fancy pot lids on the far right. Very fancy. I'm not sure anybody here has one in their home. It's just really fantastic. Made by local artisan people. Community used it. I think at the end of the day, I think it was only 2 households that wasn't using it on a daily basis. We also used trainer approach in terms of composting. I said in the very beginning that communities would tend to burn their farm waste. So having that composting training was really fantastic. Also mentioned, according to the communities, that it also helped in terms of manure for their farmland. And we're also able to provide solar lamps to every household in the community. There is a big story behind that woman, and I think we just don't have time to say it today. And also working with a local NGO, we were able to provide the community with extra lighting where they can charge their phones, because we realized they walk about 3 kilometers down to the closest trading center to go and charge their phones. And just looking at the all broader social determinants of health is not within the remit of our research, but it was a capacity that we had, and we were glad that we were able to provide that to the community itself. So like I said, our pot lid is not very as pretty as Liqueur, but a lot cheaper, but the household were using them. In terms of when we asked them at Endline, what was the most effective intervention? Majorly households said it was a Chitezo Mbaula, and all because they said it helped them to reduce smoke. Our most effective intervention is the community itself, and this quote really, really reflects that, saying that you could just come and give us anything which will not be good of no use to us, but you advise us on things that we use, and we were able to choose wisely. And in terms of the interventions themselves, you can see that the lids were very beneficial, they found, because they felt the heat were retained within the pot and that the food cooks faster. In terms of smoke on the outside, community mentioned that the smoke from the outside of the kitchen is now well reduced. It is not that much because we throw the waste found in the pits outside, supplementing it like manure. So currently, the smoke from outside the kitchen has been reduced. And when we look at it within the context of the SDG 3, you can see in the quotes on the far right saying, because the kitchen did not have windows, we used to suffocate due to smoke. And also, since you tend to stay there for a long time, we would have headaches. But now it is not common. I mentioned earlier on that sustainability has always been plaguing interventions. And the final quote says, I know that this project will last in our village because we told you what we know and you are always asking us. And this just shows the power of that co-creating knowledge with the community. To them, it wasn't about whether it was a Philips cook stove. It was that they had the power to be able to voice their own decisions. And this is our exit jamboree. Like after the all events, the community wanted a party, so they got a party. We had media from Malawi comes in, and it was reported on local video. We cooked, we had fun. The community was able to tell their story to their local government that were present using the same photo voice approach that we used. They used drama, they used news. It was really a fantastic day for us to really close out the project. So finally, this is my last slide. There are three things that we've learned throughout this project, and that for me personally, I'm taking forward, and is that we need to go into this community with respect, their culture, their beliefs. We're not there to destabilize that. And it's also recognizing our own unconscious bias and being addressing it, learning to actively listen, learn, and adapt, and realizing that air pollution is just one thing. It fits within a broader determinants of health. So there will never be a one size fits all. So we need to prioritize the community's needs and time, take time to build trust in ourselves and the community, enhance capacity and capability. And finally, to remember that behind every single data point, there is a human being in there, and we should always infuse humanity in what we do. So that's it. Thank you so much for listening and for having us here today. Thank you. Stop sharing.
Thank you so much, Eunice. That's great. And I think all the claps earlier on, Kuba's story was also wonderful. I am anticipating the fact that we might run on a little bit late. I hope that most of you can stay on. We can quickly proceed to our last speaker. And while Iyaze is lining up his slides, I would also like to warmly welcome members of the Irish Embassy in Malawi and Irish Aid who are here, because I think it's really important that we recognize that the Coalesce funding, of course, comes from Irish Aid, and it's really, really great to actually for us to all share directly the findings that have come out of these 4 projects. And I think you can also see that there's a lot more to say than just what we can squeeze into 10-15 minutes. So I very much encourage all of you to get in touch with any of the presenters if you would like a longer version of this of these four presentations. And with that, I welcome Iyaze to present their presentation. Thank you so much.
Yeah, thanks. I'm not too sure if everyone can see the presentation I've got up. Trying to share it.
Yep.
Okay, yeah, good. Yeah, good afternoon, everyone. It's really nice to see that a lot of people are still engaged and no one has left the building yet, especially given the fantastic presentation that has been put forward so far. So I will be using the next 10 minutes to try and present an overview of the Kengo project, which is focused on, excuse me, on putting forward applicable, excuse me, the slides are not working, so I'm going to try that again. Okay, yeah, which is focused on putting forward replicable mechanisms that can be applied to energy access. So in a sense, it was actually quite good that Eunice had touched on some energy issues in Malawi. So before going into the project specifics, I think an understanding of the basis of the project might be actually useful here. Should stop coughing now. So the use of small scale the decentralized renewable energy systems has actually been deemed to be quite vital for the realization of the SDG 7 goals. That's sustainable energy for all. And this is actually quite important, especially for how to reach rural areas where expansion of grid access is not likely anytime soon. But however, despite the fact that there has been an increase in the availability and also a significant drop in the cost of such renewable energy systems in the last 2 decades, the uptake of such systems in sub-Saharan Africa has actually remained quite poor. So the Kengo project was therefore guided by the central questions of, how community-driven decentralized renewable energy systems can be successfully implemented. Then how can we ensure that there's local buy-in? And also, how can we put, mechanisms in place to ensure that they continue even post project projects installation. So this led to the project objectives of, and now I've got to state that the project objectives, they did actually change during the course of the project, which was quite good. I think if you remember, Anne was mentioning that the initial scope that you put on at the start of, the proposal, it is actually very good in the sense that it allows you adapt and, and revise your objectives as the realities on ground become slightly clearer. So the objectives, the Kengala objectives to build technical and operational capacities in renewable energy systems to support and scale up local innovations and also bridge a gap in energy access was actually seen as a viable approach to afford improved energy access for sub-Saharan African countries. So a quick overview, just a very quick overview of the project approach and activities will actually be very useful to provide context before outlining some of the key outputs and findings of the project. So one of the things that we did, and I should have done what the other presenters did at the very start, talk about the collaborations that we had with Malawi University of Business and Applied Sciences, but I kept that till the very end, just to spice things up a little bit. Yeah, so we did intend to put out some expertise hubs, so there would be like in-person regional centers for engaging the local communities. And then we developed a framework, a paper-based and a digital framework. I'll go into that a little bit later. And then put forward digital and paper tools that would help the knowledge base and the renewable energy systems funding, ownership and operation. And most importantly, which regards the sustainability of those kind of systems, because most times, even in sub-Saharan African countries, even when you have renewable energy projects, they tend to fail because there's actually not a lot of competencies to carry out these project maintenance post funding. So training and competence development was also seen as quite key. And then we wanted to make sure that the approaches that we're putting forward in place, they were quite feasible. So we were going to demonstrate and validate it in practice. So regarding the framework, the development, the framework was a paper-based document. It started out as a digital, but the uptake of a digital approaches were not well received, as we found out from our first consultation with the stakeholders. And it actually covered the entire life cycle of, owning and operating a renewable energy system, from community engagement to selecting the best technologies, to something that's important as to how do you even buy it and how do you acquire it, which was quite important. And then operating it even after you've purchased it, and then training to update yourself on maintaining and operating it. And then the framework was actually developed in partnership with a lot of the um, government stakeholders as well as business bodies and associated bodies in Malawi, ranging from the regulatory authorities to the Ministry of Energy and UNDP, as well as representative of the Renewable Energy Industry Association of Malawi. So for this, we actually had workshops where we had people from those agencies come in and give us their views. And the reason for this engagement was quite vital to ensure that the framework covered considerations that were tailored to meet the local needs, because we also consulted with the people, but especially from the regulatory side of things, to make sure that, it reflected what was to be on ground in Malawi. So we were not just producing a tool that would not really mean much on ground. So for the Regional Expertise Hub, this was actually seen as a system to bring information which was already well understood and known, especially from the academic environment. As you can see, the picture on the right there is just really showing that, we all actually know about, the use of electricity and renewable systems, but there seemed to be a barrier, especially in areas where there was no grid access and electricity access was not non-existent. So the regional expertise hubs were actually to break down those walls in providing funding, advice and funding initiatives, assistance with them purchasing renewable energy systems, information on regulations, like who can install your system, best place to actually get them. And then also these hubs were actually quite important in informing the local communities on how they can actually get training on the use of such systems. So for the course of this project, we did establish three regional expertise hubs, one in three different districts, just to ensure a geographical spread in the country. So there was one in Aluwade village, and one in Amatuwamba village, and one in Uviri. So these were, there was no office, but these were physical structures in the sense that there was a contact person, there was a body, and there were like 5 or 6 participants in it that we were in regular contact with, and they were representing the communities in question. So really, with regards to the Kangol tools that were put out and the outputs and the findings, I will just actually discuss the findings as I'm discussing some of the outputs. So we did carry out one of the largest surveys ever carried out in Malawi, with 100 and to be exact, 154 households, and in the 3 villages where we had that didn't have grid access, but where we had the community centers set up. And there was not just the households in those communities, but adjacent settlements as well were interviewed. So that's research associate from the Malawi University of Business and Applied Sciences. They're talking to one of the householders. So we aimed for geographical coverage, looking at the 3 main regions in the countries, and that's why we actually elected those districts. The stakeholder consultation was really very broad consultation, and although I'll only touch on a little bit of it here, but it did cover a lot, especially on the current energy demand, what the end use might be, what their ability to own those systems are, even as something as educational requirements and current status, things like that. So just an overview, we did find out that the needs for electricity, even though they didn't have any now, was actually quite simplistic. So it was really mainly for people just wanted it for simple things like lighting and being able to turn on their radios, or if possible television, and to charge their mobile phones. That was really it. There was no grand need, for like refrigeration as to help, combat food spoilage or, to start a business or things like that. So it was really quite simplistic. So in the sense of matching renewable energy systems to the needs was really quite straightforward. And we also looked at the entrepreneurial ventures that might be needing um, 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 renewable energy systems incorporated in them. I'm sure anyone who's worked in Malawi knows about, the maize meals and sima. So yeah, I just smiled when Eunice mentioned it again because I hadn't heard that food in a while. So the maize meals were actually quite important, and so. That formed the bulk of what we call commercial farming and processing. And that was really what a lot of people were interested in using the energy for. But quite interestingly, because we went in with the idea that a lot of people were earning about, from the 2020 figures, about $2 a day. But from our interviews, we did find out that most households were actually on less than €1, $1 a day, which was quite interesting, and which made us revise the financial models we put forward. I wouldn't harp too much on the digital tools that were promised in the proposal and the project, because even though we did them and we even converted them to paper tools, one of the findings of the project was that especially community stakeholders were not very interested in tools that were being put forward, paper documents, whatever you want to, even though they might be useful to them. Now, these tools from the Renewable Energy Selector tool that was developed for the project, or the greenhouse gas estimator tools, they were a bit more welcome by the Renewable Energy Industries Association of Malawi, and so it was a very good output of the project. But we start out this project with grand ideas of having this kind of tools, but its end users at the end of the day, I think it's quite important. That's something that Eunice was talking about. Listening to them as to what they actually need was quite important. But the financial models that was put forward by the project and the funding database, the end users, especially the community groups, did find them quite useful because they were able to consult it to actually see how they could fund such systems. During the course of the project, we did get a lot of feedback as to the interest in having community scale biogas plants. So, as a side note, the project then also looked at exploring the role that decentralized small scale biogas plants could actually have in meeting energy needs, especially for cooking and potentially for decentralized electricity generation in communities. And from our findings, we did find that with about 12 cows, you could actually have so between 6 to 12 cows, you could actually have such systems in place, and that was actually published as part of the project. So with regards training, we did put forward a bachelor level and a certificate course with our collaborating partners in Malawi. That's the Malawi University of Business and Applied Sciences. So by the end of the project, it was already fully developed, and hope it was going through the ratification process. But again, another finding we did have from the community engagement and the stakeholder engagement was that a lot of people in, especially the kind of communities that we're trying to target, found university-based learning, even though they were distant learning courses, to be a bit elitist and out of reach. So in that sense, even though we hadn't intended it at the start of the project, we had to revise the objective and then partner with a vocational study, a vocational college, where we put forward some courses that were relevant in the training of the targeted stakeholders. So, in addition to the in-person courses, we did also put forward an online training platform with the Green Action Community College. So that is also citing Research Ireland and the Department of Foreign Affairs and the Kengo project for the funding of this online platform to actually try and and enhance the reach of such courses. And we did try and contribute to some of the training courses in them. So finally, as part of the project, we found out that a lot of the renewable energy landscape was very import focused. So we wanted to also then reflect on how to improve the local production, local innovation of renewable energy systems. I mean, it wasn't novel, but we're trying to actually encourage local innovators and see the impact that they might have in communities. So we put out an open call during the course of the project and got about 16 submissions from local innovators. Very all interesting, but we're quite limited in how we could fund. So we ended up funding 4 of those projects with some quite small, only about 400 euros each. And these are the technologies. So one was a biogas plant, which was actually put out in a village. And then another was this innocent who actually had developed a stove which we could be used for slow charging of mobile phones while you're cooking using briquettes. And then George, who actually had produced a mill, a solar panel powered mill for producing livestock feed, and Joshua John, who actually produced a power bank. And so all of this were actually tested even before the end of the project. And we're seen to not just only have potential cost savings for the users based on their current expenditure on energy, but there was also, interestingly, a significant CO2 reduction and emission reduction with their use. So the framework that was produced, the financial models, and also the training platform was validated and tested with a women's community in Shea Elifa village in Blantyre. Where that's us the day we delivered the mobile 1.1 solar panel irrigation system. So it was actually seen that there was close to 70% potential savings in irrigation and manpower costs, which was actually a very good outcome from the project. So yeah, the project was really a collaboration with Atlantic Technological University, Sligo, and also Malawi University of Business and Applied Sciences. So, yeah, it's just thanking everyone who was part of the project team. And I really, really would also like to use this opportunity to not just acknowledge the funding that was received for the project from Research Ireland and the Department of Foreign Affairs under the Qualis program, but to actually say a massive thank you to the funders for the opportunity to be able to engage in a fantastic collaborative project, which has real world implications and impact. And I really do hope that despite increasing, I mean, loud out, maybe not increasing global calls for government-funded institutions to be a bit more insular. I actually hope that such important funding mechanisms, especially with far-reaching impacts for the developing countries, are not curtailed. I just have a small, because I think if you've never, for those of us who've been able to work in Malawi, and I think when Jakob was actually sharing the dancing, I think it's a theme. Once you've worked on a project that you know there's real world impacts, it really takes you home with you, especially when the singing starts and the gratitude actually comes in, and then you get to realize that your research is actually quite important to these people. So, so just can't open the video, unfortunately. So I think we'll stop there then. Yeah. Thank you very much.
Thank you very much. That was a great presentation. That's wonderful that we got to get the insights in 4 incredibly different interventions. I Our participation has dropped a bit because I think lots of people probably had another commitment at 1 o'clock. But with your permission and those who are still around, maybe I can say we can go to 20 past 1 or 25 if anyone has questions for any of the presenters. Anne unfortunately had to go. If there's anything on the first presentation, I'm happy to chat, but there's so many interesting presentations that we saw today. So please, if anyone has a question, you can unmute and just go for it, I think. Way by the sheer quality and the diversity of what we saw. I have a real sense that the various projects should also speak to one another, because I also feel, and this is exactly what I thought might happen, is that there's great overlap. And I certainly know from Jakob's project that they're carrying on with the second installment of the Akazi project, and there's also a water project that is being implemented by him and his colleague Chiara, who's also on the call. So I really hope that there might be some links and some collaborations. You never know in the future. Are there any questions for any of the speakers?
Not a question, but just a big thank you to all presenters and research teams. I joined the embassy here only a month ago, and I feel like I have learned as much today listening to the four of you than I have in the month that I've been here. So just a big well done, and it's really fascinating, different fields of research.
Thank you. Thanks, Sarah. That's really nice. Nice to hear. Yeah, I would certainly encourage you to reach out to the presenters. I'm sure we can probably, with everyone's permission, put some details of the 4 projects on an email and share it. We'll find you one way or another. Yeah, because I really feel that this is a wonderful way of bringing the fruits of these wonderful investments that the Department of Foreign Affairs has committed by continuing to fund the Coalesce project. They shouldn't go unnoticed. They should certainly be shared far and wide, and certainly with both NGOs and also with the department in country. Thanks for being here, and I'm glad we managed to update you on some great projects. Anyone else? I completely forgot to mention that we were recording this. I hope that's okay with everyone. If not, I encourage you to get in touch. But we are hoping to put this on the DSAI website as well, so that others can go back to this presentation and see these 4 great projects. Well, if there's no other people with urgent questions, I would like to once again thank all the presenters and thank Miriam for bringing this all together. And well, I hope to see you at the next one. I'm sure that DSAI will continue with maybe another series of finding sharings from the Coalesce and other grant projects. So thank you all, and enjoy the rest of your week. Take care.
Thank you very much.
All the best.
Thanks,
Thank you.
Petra.
Thanks.